Hello everyone, this is BrainlessMedico and I am Dr. Manoj, and today we are going to learn an important topic in medicine, that is diabetic ketoacidosis. Okay, let's dig into it. So, what is diabetic ketoacidosis? Definition, it goes like this. It's an acute, life-threatening complication of diabetic mellitus. It is characterized by hyperglycemia, ketosis and metabolic acidosis. And most commonly it is seen in type 1 diabetes but can also occur in type 2 diabetic mellitus under stress. Then coming to pathophysiology, so mainly it is related to absolute or relatively insulin deficiency. Let's go with the stepwise points so that you can write well in the exams. So usually diabetic, there will be insulin insufficiency, which leads to counter-regulatory increased regulatory hormones, which are like example glucagon, cortisol, catecholamines. And there will be increased gluconeogenesis and glycogenolysis, which leads to hyperglycemia severely. And there will be osmotic diuresis, which leads to dehydration and even electrolyte loss. Meanwhile, what happens? Fat breakdown will take place, which is also called as lipolysis, which leads to free fatty acid converted into ketone bodies. Example, acetoacetate and beta hydroxybutyrate. Leads to metabolic acidosis, and this acidosis causes cosmal breathing. Okay, fruity odor smell. Okay. Then coming to precipitation factor, you can remember 5 I's, which are infection. Most commonly, this is the most common precipitating factor. Then insulin omission, like missing the dose of the insulin. Infarction, vascular diseases like MI or stroke, illness, which is mainly pancreatitis, which leads to insufficiency of insulin secretion. Then it may be related to trauma. At last, it comes to inadequate insulin therapy. Then, so you need to search what is the actual cause, means precipitating factor is present or not. So this point says always search for a trigger in diabetic ketoacidosis. So in clinical features, we will divide it into early symptoms and severe features, where polyuria, polydipsia, weight loss, fatigue, it will be seen in every diabetic conditions. Whereas in severe, we see vomiting, abdominal pain, dehydration, as I said, Cosmal's breathing, fruity breath, that's what Cosmal respiration, altered sensorium, and coma. Okay. So abdominal can mimic acute abdominal pain. Then coming to investigations, important point, diagnostic criteria, parameter, you have to look into it. So coming to blood glucose level, it will be about 250 mg per dl. Arterial blood, it will be 7.3, less than 7.3. Then coming to bicarbonate, it will be less than 18. Then ketones will be positive, as we discussed in the mechanism. Then other findings we can see is increased anion gap, which leads to which we saw that there will be acidosis. Then serum potassium may be normal or initially high. Urine ketone bodies will be positive since it is secreted excessively. Then coming to total body potassium is always, remember, it's not normal, it's low. Then coming to management, like this is an important part. We'll divide it into 5 steps. First step, you need to fluid resuscitate, where 0.9%, 0.9, this is a MCQ, 0.9% normal saline. Like you have to give 1 to 1.5 liters in first hour, which corrects the dehydration. Then next you have to go with the insulin therapy, where you have to give regular IV insulin infusion. 0.1 units is preferred. Okay. Then coming to step 3, you have to correct the potassium according to the currently available potassium levels, which may be like less than 3, or it may be 3.3 to 5.3 and more than 5.3. It depends how you have to correct. If it is less than 3.3, then you have to give first insulin. First you have to give potassium, then you have to go with the insulin. Then if it is between 3.3 to 5.3, add potassium to fluids. If it is more than 5.3, then no need to give potassium initially. So remember, the summary of the third step is like, first you have to give potassium if there is less in the serum. If it is above 5.3, then no need to give potassium initially, because the deadly complication of the potassium is arrhythmia, which is like, again, we have to manage. It's difficult. Then coming to fourth step, bicarbonate, usually we won't give if it is preferred only in the special condition where pH will be less than 6.9. Then at last, after managing the emergency, then you can go with the regular treatment. Antibiotics is given if any infection is found, and restart insulin education that you have to teach. You should not omit the doses of the insulin. Coming to the complication, most common complication will be cerebral edema. That will be mostly in children's, most commonly. Hypoglycemia, hypokalemia, ARDS, then acute kidney injury. You have we'll make a separate video on this double HS. Let's differentiate this diabetic ketoacidosis with HHS. Okay. Here we'll see ketosis will be present in diabetic ketoacidosis but absent in HHS. Coming to acidosis, present in the diabetic ketoacidosis but it is absent in HHS. Then coming to glucose level, it will be moderately increased in diabetic ketoacidosis, whereas in HHS it will be very high. Why? We will learn in that specific video. Then type of diabetes most commonly involved is, we learned that type 1 is most commonly involved in the diabetic ketoacidosis, whereas it may be type 2, but in HHS most commonly it will be type 2. So at last, if someone asks what is diabetic ketoacidosis, you need to remember these points. What are these points? Diabetic ketoacidosis is a condition where hyperglycemia is seen, where ketosis will occur, which leads to metabolic acidosis. Treat with fluids first, then insulin. Okay, we said like 0.9% of normal saline will be given, then we'll go with the insulin, then we'll go with the potassium. Then at last you have to find the actual cause, why it happened. So that was all about this diabetic ketoacidosis in this video. If any doubts, you can use the comment section, and if anyone wants the notes, you can ask me in a comment section so that I'll personally send them this PDF actually. Okay, that's all. Thank you.